I surround myself with really smart people, really, loyal people like you and Dr. Bombi and, and people who can kind of protect me from the forces outside.
Or yourself.
There. Or myself. That's right. I could hurt myself. That's so true. That's true. It's a beautiful day out there. It's going to be about whatever you see today. We're going to have a carbon copy tomorrow. Cold in the morning, but clear and actually quite lovely out there, even though the wind is going to be picking up in the afternoon. So I want to thank my previous guest, Mr. Trevor Horn from Garces Memorial High School. He joins us every Friday. We're ready for our Centric Health segment. We feature here, I'm proud to have him on the show, Dr. Bridget Bombi is a local cardiologist and an officer of Centric Health. We've been covering the coronavirus, the pandemic, for months now. He is one of these guys who's able to break down the really, really complex issues and give it to us in bite-sized forms. Dr. Bridget Bombi, welcome back to the show. How are you, sir?
Richard, I'm well. I just learned that it's Friday the 13th. I didn't know all day long, so I have to be careful for the rest of the few hours.
Well, sorry to give you bad news, Hey, I got to ask you, Dr. Bombi, we've been living with this thing since the first of the year, and I understand the dangers that are in front of us with this next wave upon us. But the way it has been portrayed, Dr. Bombi, is ominous in a way. I'm looking on this. I told JR back in another life, I lived in Miami, and we would anticipate when the hurricanes would come, and they would get closer and closer, and you would build your life around whether you were going to evacuate or board up your home or your business or drive up to Orlando inland and stay with a friend or whatever. And I feel a little bit the same here, that right on the horizon we have this horrible explosion of the virus coming, that already 1 million people in California has been affected. It just seems like I'm bracing for something horrific. Tell me in your words what we should expect, and along with the vaccine, we know that's when we might get some relief of this. What are we in for over the next few months?
So, Richard, here are if you have to tabulate the negatives and positives and make a spreadsheet version, the negatives are these. 1, this is the first full winter season when the novel coronavirus is going to have run at us. 2, it also is going to have flu season along with it. 3, the vulnerability to the virus remains largely untouched because at the most 10% of the population, maybe 15, definitely less than 15% of the population has been exposed to the virus. And assuming the immunity is durable starting March, April onwards, there is still 85+% of the population that's exposed. So the negatives are, it's the first full season in conjunction with flu with abundant vulnerability. The positives are that we are not being blindsided now. We know about the virus and its behaviors, and fortunately there is a substantial amount of mask absorption and substantial amount of distancing and other preventative measures that we have adopted. Sadly, though, we are seeing a lot of virus fatigue, and people are more anxious to intermingle and thus expose themselves to the wrath of the virus. On the positive side, going down the list, there is a therapeutic improvement. There is a mortality reduction outside the hospital. There is a mortality reduction inside the hospital for a variety of reasons, which we have enumerated more than once. But looking at the winter season, looking at the pent-up social desire to intermingle with the friends, with the families, we are going to set up ourselves for the ominous threat that you implied if we are not careful about it. And what does the winter hold for us? We determine. Virus doesn't determine that. We determine that.
Wow. So it's really, I mean, I guess we knew this. This is up to us. And I didn't, this is the first time I heard it framed that way, that this is the full winter, because we didn't catch this thing until February, March. This is the full winter of it. And then combined with the flu. Tell me how the flu complicates the treatment of the virus, or does it? Or is it just that some of the symptoms are similar?
The flu, we'll have to find it out, right? What happened in the southern hemisphere, actually, when we had the summer, they had the winter. They had a very contained flu because they were practicing the distancing measures and the masks. So it's conceivable that we may have a lighter flu season if we are more compliant with the safety measures which are ingrained. At least we know it, even if we don't practice that. How does the flu interact with the virus? We don't know, but theoretically speaking, if somebody's lungs or airways have been affected adversely by a flu virus, they're obviously more receptive to a worse outcome if there's a concomitant infection with the corona or the COVID virus. So the two in conjunction obviously present a much more dangerous scenario. But the preventative measures, which we have to continue to reinforce, are the same. The barrier is the same against both the viruses. And you mentioned off there about Thanksgiving. It's very important that Thanksgiving doesn't become another seeding occasion like we had Memorial Day and July 4th. The Thanksgiving, obviously, because it will be celebrated inside, presents a much larger danger because of the three C's which we have repeatedly talked about, the close contacts, the close spaces, loud voices when we are talking to each other, and crowding. Add to that the ventilation, which may or may not be adequate. So what has happened is the family gatherings and the kitchen table is likely to determine the outcome, immediate outcome, during and after the Thanksgiving, and this will continue through the Christmas. So we really need to be cognizant of the fact that we have the quarantine fatigue. Virus is just captive of its biology. All it needs is an opportunity to replicate, and it will continue to replicate. So we should be cognizant of the seeding events. We should minimize opportunity for the virus to spread from person A to person B, and that's extremely important that we observe those preventative measures, and it's all within our power to do that. If we don't do that, we are, as we talked last time, we are on Team Virus, not on Team America.
Yeah, right. We're talking to Dr. Bridge Bomby, 842-5376, if you want to text a question in or have pose your own question to Dr. Bomby. Dr. Bomby, so here we are. It's the middle of November. People, long before this date, have been looking toward the winter. You have Thanksgiving coming up. You have Christmas coming up. You have New Year's coming up. You have three events that could be super spreader events, even if people don't intend them to be. From your vantage point, tell me how people should be planning their winter travel. Would you advise them just forget about seeing the grandkids? These are the times you talk about virus fatigue. People have gone months without seeing their children, their grandchildren, their parents. And this is the time when families get together. Would your advice would be just write this winter off and let's get into the spring? What advice would you have for them?
Richard, it tears your heart out that the grandparents have to be separated from the grandkids. That's the greatest joy. That the thought that the grandkids have to be abandoned for that long, and some grandparents have died during this forced or necessary separation. It just tears your heart. Give you an example. I have a friend who's the dean of Baylor in Texas. He has a patient, a 65-year-old attorney. He observed quarantine till his sister died, and he came to attend the funeral, got the virus, suffered for a month, and then died in the hospital. So the answers are not easy. Not everybody's going to get fatal infection, but some will. So the brain says, the mind says, please observe separation. Please observe distances. The heart will lead to possibly adverse outcomes. I feel, and it's not easy to advise, stay away from your family, stay away from grandkids, but it may be a necessary sacrifice. And we're looking at the other end of this painful pandemic. We have the vaccine, which is very powerful vaccine, and likely we have a bunch of different vaccines. We're looking at an opportunity to get on the other side of the pandemic, but understand we are still in the middle of the tunnel. If we jump off the train now, it's not a good idea. We still have a long way to go before we can step and walk into the light.
Okay, and let's talk about getting to the light, because we finally, it looks like we're honing in on the Pfizer vaccine, which has proved to be 90% effective in field tests. Yet there's questions about rolling that out and who will get it first. And could you explain to me, are all the vaccines, or is it just the Pfizer vaccine? Is this one going to require a shot and a booster shot, or 2 shots, however you call that?
First, a couple comments about the Pfizer vaccine and the Moderna vaccine, which are based on messenger RNA, or a piece of the genetic material which is injected into the body. And then the body actually produces the spike protein. The spike protein is the key to the lock that gets into our cells in the body, and then the virus takes over and uses the cellular machinery to self-replicate. The advantage of using a genetic material in producing a small part of the virus from within the human body is that it's less likely to be contaminated by other proteins, and thus less likely to create other immunological consequences which are adverse. So there's a hope. Right now there isn't evidence, but there's a hope that a cleaner target-specific technology may lend to a vaccine which is much cleaner, lower side effects, may even have a long-lasting immunity, and more importantly, set up a platform vaccine going forward. We may be much more prepared for the next pandemic because of all the efforts that has gone into developing the vaccines for this virus. So, but moving along, the Pfizer vaccine has hit all the expected favorable targets on time. The number they looked at was 94 people, 94 infections. 85 of them were in the vaccinated side, on the non-vaccinated side, and 9 were on the vaccinated side. So out of 94, only 9 people got infection that didn't get the vaccine. So that means that got the vaccine. That means it was 90% plus effective in eliminating the infection. But that was only 7 days after. The data only extended to 7 days after the administration of the vaccine. So what does it hold? A month later, a year later, 6 months later, it's still up to evaluation. Also, when the studies are conducted, it's a very controlled environment. It doesn't really replicate the real-life situations. Would it apply to older people? Would it apply to people who have diabetes, heart disease, obesity, other things? So the facts need to be sorted out, but it's looking very good. One downside to to the Pfizer vaccine is that it has to be stored at minus 94 degree Fahrenheit freezers, and there ain't enough of that. And then CMS has some more regulations that determine that. Also, the vaccine can only be dispensed in roughly 1,000 units at a time. So it can be less than 1,000 units or 950 units. So the doctor's offices can keep it. So some hospitals may be qualified, others may not. So there will be distribution bottlenecks. There will be logistical hurdles because of extreme temperature requirement for this vaccine, and the cost. The cost of this vaccine is about $20 per shot, so that's $40 for this vaccine for the 2 shots, so the initial and the booster. The Moderna, similar technology, will require less intense temperature requirements, so that may be more easily disseminable. But not all the vaccines will have 2 shots. The Moderna and the Pfizer will have 2. The others may have only 1.
Oh, that's there. Is there a chance that we could be? Would one strategy be to introduce both vaccines, and it just might be a matter of coincidence or luck that you got the Moderna vaccine as opposed to the Pfizer vaccine, or vice versa?
I'm sorry, I didn't get that question.
Is there a chance that the government would approve both vaccines and that we would be inoculating?
Yes.
Okay.
I'm pretty sure there will be no chance. There's a high likelihood that both vaccines will be approved. And then it's going to depend upon availability, because the demand and supply equation will not be settled. So some people will get Moderna, some will Pfizer, some maybe AstraZeneca, and other. So we will all get different kinds of vaccines.
Okay, and can you tell me about this this new drug, this fluxamine or whatever that? What's it called?
I don't know either. It's fluvaxamine or something like that. It's a psych drug used for OCD, obsessive compulsive disorder. So they had this preliminary study. I think it came out today in Journal of American Medical Sciences, and it basically shows about 80% reduction in bad outcomes in people who were on this drug incidentally. Part of this drug is anti-inflammatory action like the steroids, the dexamethasone and others. So it's and other, I mentioned earlier that we at Centric Health are doing a trial on colchicine, which is another anti-inflammatory medicine, and we're dispensing it for free in a very expeditious manner for people who have high risk of getting a bad outcome. So it's on those lines. So that it's an anti-inflammatory component of this medicine that seems very encouraging.
Okay. Well, could you tell me about what Centric is doing?
We have a trial. It's called Calcorna. So it's the Calcorna, C-O-L Corona. Colchicine is a medicine that's used for anti-inflammatory actions in people who have gout. So, and we are trying to see. This is an international trial we're doing in conjunction with universities in Canada, New York, and others, where people who are at high risk of adverse outcomes, age over 40, diabetes, other concomitant factors, from the day they're diagnosed within 48 hours, we dispense this medicine free of cost. We actually find ways to deliver it to them, and then we're trying to see if this makes a positive impact on the outcome side.
Oh, wow, how interesting. Okay, very good. All right, we're out of time. 2:26. Man, that was fast. Okay, well, thank you for the advice as we go forward, and I know you'll be with us as we head into the heart of the winter, and we'll see where this goes. I hope everybody, my advice, and I think Dr. Baumby's advice would be, we have to deal with the precautions we have, and if we end up with super spreader events over the holidays, we're going to be paying a dear cost at some point in the near future. So, Dr. Baumby, thank you again for joining us here on this Friday, sir, on Friday the 13th, and you need to take care of yourself today.
Absolutely. And remember, a little bit of distance lends warmth to love. Remember that this year.
I like that. Thank you, Dr. Bridgebaum. We appreciate it, sir. I'll be talking to you next week.